Right. Welcome to the Just for the Health of It podcast, interviews with our local health experts. I'm your host, Drew Crawford, with Warren County Public Health, a public health educator. And today we're excited to talk with Melissa Carbone, the director of the Ryan White program at Hudson Headwaters Health Network. Obviously, with HIV and World AIDS Day coming up on December 1st, this is an awesome program to talk about. We're really excited to talk with you. And thank you so much for coming on today.
Great. It's really great to be here, Drew. And it is a good time with World AIDS Day coming on December 1st. It's on December 1st every year. And the theme this year is really about equity. It's about making sure that everyone has some kind of equal access to care and treatment. And it is really a day of uniting around the world to remember folks that we've lost to AIDS-related diseases and to kind of unite to really continue the fight, to find a cure and to for treatment and things like that for HIV.
Absolutely. And, obviously with your role in the Ryan White program, it's obviously an incredible role. I mean, the impact that you can make on individuals is exponential. So if you wouldn't mind kind of introducing yourself, how did you get into the role? Any expertise, any fun facts? I know when we did our first one with, Dr. Malheidi, she actually expressed that she did water polo in college. I don't know if you've got anything quite as similar, but it's always a good thing to bring up.
I definitely do not play water polo. So yeah, I actually so I have my bachelor's in psychology, and took the road less traveled to get to where I am today. I actually then did a little bit of teaching, so I'm actually certified as a health teacher. And my master's is in health studies and promotion from the University of Alabama. And I spent many years with the Council for Prevention, doing school-based prevention work in alcohol and substance use prevention with students from kindergarten through college age. So I was doing that for a long time. And this position came up as it was really started out as a community liaison person. And I was doing a lot of things out in the community. And I've been in the Ryan White program with Hudson Headwaters for 10 years now. So I've done a few different things, worn a few different hats, and I took on the director role about almost 2 years ago. And the group, the team has grown so much in the last 10 years. And I'm the director, but honestly, the team I have is amazing. And it takes all of us, and we do great work as a team. So
Yeah, absolutely. And,
yeah, interesting
obviously,
things though are not big water polo.
yeah,
I could
no,
say one thing is that I used to live on 100 acres with a donkey and a cow and 6 dogs and
oh,
a
wow.
trio of very not so nice geese. But um, so that was an interesting time. That's for
Alrighty,
sure.
I can imagine. And, obviously, as you were pointing out, your team has been growing exponentially, and so has Hudson Headwaters overall. I mean, you guys
Mhm.
are one of the most, I want to say, connected health networks in our area right now, with, going all the way down to downtown Glens Falls and all the way up north to, Johnsburg and Warrensburg and those places. Those are areas that we definitely want to see. And, as we were talking about health equity, it's not always just about racial health equity, but also about rural health equity, bringing those resources and bringing those things to people that maybe aren't going to be able to go there. I know that if I lived up in Johnsburg and Warrensburg, I'm not driving half an hour, 45 minutes all the way down to downtown Glens Falls to get tested. So, obviously with you guys' mobile health team and
Yeah.
everything, all your initiatives, you guys have been absolutely incredible. So, why don't we jump right into HIV and AIDS? And, I think the most important thing that we should definitely discuss is the distinction between HIV and AIDS. They're often clumped together, but in reality, they're two very separate things. So if you wouldn't mind kind of explaining what's the difference between HIV and AIDS?
You're right. They're always sort of paired together. We always hear HIV and AIDS together, and they are very different. So when we talk about HIV, we're talking about the human immunodeficiency virus. And so this is a virus that people can become infected with, and we'll probably talk about how. Um, and so someone may get this virus, and they may have this virus, and what happens is going to depend on whether they're in treatment or not, whether whether they actually know they have this virus or not, and what's going on. But if they're not in treatment, if they don't know, and this infection progresses, they might wind up actually having what we call AIDS, which is acquired immunodeficiency syndrome. And that's when they might reach the point where they are getting what we call opportunistic infections, like things like certain types of pneumonia, certain types of cancers, all kinds of things that are very particular to HIV. Or they may have very low levels of what we call CD4, which are certain types of white blood cells. And when someone is at reaching that point, they are probably very sick. They are not feeling well. They're getting sick with all kinds of different things, and their immune system is really just not working. And so someone can have HIV, can have that infection and not be sick, whether it's because they haven't progressed or because they're in treatment and it's managed. But if not, they can become at the point where we would say that they have AIDS.
Yeah, absolutely. And, obviously we want to talk about the transmission of it, transmission of HIV. There's many different ways, but, mainly it's traveled across through blood, and there's a lot of different ways that people can transmit it. So, are there areas that you are seeing where there's more transmission, there's less transmission? I know that from the CDC statistics, we're seeing a lot more. I think it's something like, let's see here, it is 70% of the cases were from male to male sex, unprotected sex, and then 22% were from female to male sex. So, HIV does have the stigma and connotation of being just a gay sex virus, but it can be transmitted from male to female as well. So if you kind of would like to talk about the other ways that this virus can be transmitted, and, kind of the ways that you guys see it.
Definitely. So the majority of transmission of HIV is going to be through sexual activity. I would say somewhere in the mid 90% of HIV transmission is going to be through sex. So it's often kind of thrown in with other sexually transmitted infections. We do see that it can be transmitted as well through drug use, whether that's sharing needles or other drug paraphernalia, or even snorting drugs can be a way to transmit HIV as well. So, anything that's, when we talk about drug use, you want to be careful about that. But for the most part, we're talking about sexual activity. It can be, the majority is going to be what we call men who have sex with men, but it can be, men who are having sex with women. It can be any type of sexual activity, so that's where we see the majority of transmission. In the past, we did see transmission through things like blood transfusion and blood products, but we really don't see that anymore. We kind of very swiftly fixed that problem. We have also seen it transmission from mother to child, perinatal, but we also have done a wonderful job of eradicating that for the most part in the United States. But again, HIV is a global problem. So in other countries, other continents, that is still a very big problem. But here in the US, we don't really see that so much at all. So the most of it is we're going to focus on prevention of this transmission through sexual activity.
Yes, absolutely. Safe sex. It's everybody's favorite topic in health class. It's everybody's favorite, most uncomfortable conversation to have, but it's a conversation that needs to happen. Absolutely.
It's very unfortunate. It's kind of this taboo subject, and it's a disservice to our youth because maybe we talk about it a little bit in our health classes and one time, and it's just not enough, because we are seeing such high rates of STIs among, our young people. The newer diagnosis of HIV, we see a lot of among, our, younger up to 24, 25, 30-year olds. So we're just not giving them enough information and education and about how to prevent all of these different infections.
Absolutely. And it's fantastic that you say that, actually, because the CDC actually has a lot of statistics that back that. From the 18 to 24 age range, they made up over 67% of HIV transmission cases,
Yeah.
and a lot of that, again, was through over 92% was through sexual activity. So as uncomfortable as it may seem, it's definitely a conversation to always have, whether it's with a new partner, a current partner, it exists, there's all sorts of different things that you can always talk about. And it's definitely something that you need to keep an open mind about and always have that conversation with, even if it's not always the most comfortable conversation.
Absolutely. We like to tell people, to come in for testing with your partner. Make it I said to make it a date night, go out for dinner, come for testing, and then go to the movies or something like that. But, and make it part of the conversation. Absolutely. Your
Absolutely.
testing.
And,
My always
as
said was, I'm sorry, I
no,
always
you're
said that
good.
if you were comfortable enough to have sex, you should be comfortable enough to talk about it.
Absolutely. If you can't have the conversation, you probably shouldn't be doing it. Yep.
Exactly.
So, as we kind of talked about, practicing safe sex, there's a lot of different ways to do that. So, that can also help prevent the transmission. And it talks about the prevention of HIV and AIDS. And, so if you guys wouldn't mind, if you wouldn't mind talking about how does somebody practice safe sex? It seems like an easy answer to the question, but there's always a lot of different ways that people can do this.
It seems like an easy question, doesn't it? So one of the things, of course, is abstinence, right? And the tricky thing to that is that people define abstinence differently, right? What does that really mean to someone? And sometimes how they define abstinence doesn't necessarily mean that there's no risk involved. So not engaging in sexual activities means you don't have risk, right? Because any type of sexual activity can have risk. Obviously, using condoms is really the only way. If you are sexually active, it's the only product there is to help to prevent infection. It's kind of a trick question I often ask young people is like, what else do you have besides condoms? And we really don't have anything. We have a lot of choices for birth control, but for infection prevention, condoms is really the only thing we have, and they're not even 100%, right? So other things we can do is have those conversations with our partners, right? Of course, the more partners somebody has, the more risk they can have. So, thinking about how many partners we have. There is one very it's been around for a few years now, but for some people, PrEP is a really good option. And PrEP is a medication. It is an HIV prevention. It's one pill a day, and it is very successful. It does actually prevent HIV infection. And people who are perhaps in a relationship with someone who is HIV positive, it's a great option. People who do have many partners, it'd be a good option. For people who are sometimes sex workers or engaged in survival sex, this happens. It could be an option as well. So PrEP is something we can do to protect ourselves. Condoms, conversations, abstinence, those are all things we can do.
Yes, absolutely. And they seem like the very basic things, but they work. They're the things that have been proven to be effective. And it's not always the most comfortable thing to talk about. It's not always something that everybody wants to bring up on the first date, or somebody there's something that they don't really want to bring up in general. But obviously with the condoms, there's male condoms, there's female condoms. You even have, you know, dental dams, you have all sorts of different options. And then, as you said, PrEP is a really big one. It's really exciting to kind of read about. I mean, I'm a gigantic nerd, so I like reading through all the studies about it. So I've been, you know, on that train, and I absolutely love it. I think it's fantastic. But there's not only just PrEP, there's also PEP as well, you know, the post exposure. So
correct. Yeah. So, and going back to what you just said, right, there are different, there are condoms, there are female condoms, there are dental dams, there's Laurels, which is kind of an enhanced dental dam. It's actually kind of an underwear like a dental dam. There's a lot of options out there that can give people different measures of empowerment. PEP is a little different. It's not well, it is a preventative, but it's a post-exposure preventative. So the other things we're talking about would be like, you know, pre-exposure. PEP is historically was really used for, say, an occupational exposure, say a nurse who maybe has an accidental needle stick and they don't know if the patient has HIV or not. They might use PEP, but we also see it now used a lot with a sexual assault cases, right? Someone has come in and they don't know if the assailant may have had HIV. We also see it sometimes with people who have had a maybe casual partner, and then they find out they have HIV and they don't know. So they will come in, they have to go to the emergency room. They have to do it within 72 hours. And they can start a course of PEP, which would be, it's actually 2 medications that they would take for 28 days. Through the ER, they would start with a 7-day set of medication, and then they would follow up with a provider for the rest and to continue testing. Because what we would do is watch to see if the person did seroconvert to HIV during that period of time.
absolutely. And, you know, obviously, as we're talking about all of this stuff, there's a huge narrative change from HIV and AIDS. You know, it used to be during the 80s and 90s during the HIV epidemic that the life expectancy, if you got diagnosed, it was 1 to 2 years. And now with, you know, all the advancements and all the education that we have and all the consultations that you can have, you know, all the specialties and everything, people are, you know, a person diagnosed at 35 can now live well into their 70s and into their 80s. You know, it's completely different. It's a completely changed narrative. And, you know, even the CDC has definitely changed it as well. Instead of a chronic illness, it is now a chronic manageable illness. You know, it's something that you can do something about. And, you know, obviously prevent the diagnosis if you can, but if you do happen to be diagnosed, it is not as much of a scare anymore. You know, there are ways that you can manage your illness. And, you know, as we were talking about with PrEP and PEP and, you know, all these different things, there's a lot of different ways to do that. And, you know, if you wouldn't mind kind of talking about how does somebody get diagnosed with HIV? What are some of the tests that you guys can have?
Right. So you're absolutely right. We've come such a long way. Back in the 80s and 90s, we really had no treatment whatsoever early on, and then some not very good treatment. Most people did face, you know, what they would call a death sentence. Today is very different. Today, people diagnosed with HIV do have a normal life expectancy. And it is a chronic, manageable illness today. So how do people find out? Well, they have to be tested. The only way to really find out is to be tested. And that can happen in different ways. Hopefully, what we want to see is that it's normalized. Testing is just part of all the other tests we often do, you know, just the regular annual things we do. Or maybe it's part of when people get their annual or regular STI testing. They can come into clinics. Public health often has clinics. They can come see us and do testing. There's lots of ways to get testing done. It can be a rapid test that's like a screening test, or it can be a regular blood draw that's going to tell you give you a more definitive answer. But testing is the only way to find out. some people are testing in a proactive way, and some people are testing because of a reason. You know, I've had an exposure, I'm concerned for a particular reason. So people test for different reasons. But that's what you have to do, is test. And everyone should test. If you are sexually active in any way, you should be testing. Even people who, I know I have a lot of people who say, I don't need to test. I've been with someone, the same person forever and ever. And well, we still should test.
Yeah, absolutely.
Your sexual health, and no matter what.
100%. And it's always better to be safe rather than sorry, you know, and especially with, you know, an HIV test, you really want to catch that before anything else happens. As we said, you know, if you have it, but you don't test and you think you're okay, you can get very, very sick, and you can get those opportunistic infections that we were talking about earlier. And, you know,
you can also give it to someone else.
Absolutely. You could be a spreader as well. And, you know, obviously nobody wants to carry something like that. So when, you know, obviously with the Hudson Headwaters, you guys do an awful lot, whether it's early intervention services, your prevention services. And if you wouldn't mind talking about what does the Ryan White program offer for individuals and community members like myself?
So we offer rapid testing, and our rapid testing is free. You don't have to give us any insurance information, doesn't go through insurance at all. It's totally free. And our rapid test takes only 15 minutes. It's a simple finger stick. It's about 99% accurate. And it is an antibody test. So it's going to tell us if a person is creating antibodies to this virus. And that's what our body does. We create antibodies to fight off something that doesn't belong there. What we would say is, if we had a reaction, we had a reaction here, it looks like there's antibodies, but you need to have a confirmatory lab test. And so we would go to that next step. In the event that somebody did have a confirmed HIV test, then we would go to that next level, and we would get them linked to an HIV provider. We would get them onto HIV medication. We have same day start right in the office. We can also talk about one of the newest types of treatment, which is an injectable treatment. So people can actually have an injection every 2 months instead of taking one pill or 2 pills a day, which is a very nice option. And we would help with insurance, we would help with medication, and all the different barriers that there might be. We would help to overcome them to make sure that the patient is going to have the best care that they can. And anything that they need, we will help them to get
Absolutely.
there.
And, we really thank you guys for all the work that you guys are doing throughout the county. You guys, like I said, are one of the most connected health networks out there. Whether, like I said, all the way from Glens Falls, all the way up to Warrensburg, and, even further north, you guys have really changed the, as we were talking about with health equity and the HIV and AIDS equity. That's going to be the theme for this month and this day. So, if you wouldn't mind kind of talking about how are you addressing that equity challenge, whether it be through your mobile health team, whether it's through the offices that you have further up north into rural communities. So if you wouldn't mind kind of talking about how are you guys changing the equity narrative, and how are you guys facing that challenge?
And it is a challenge because we are a very rural and a very large geographic area. We actually have 21 health centers at this time, and we actually go all the way to Champlain on the Canadian border. And our furthest south, we are in Moreau and Saratoga County. So it's a very big space. So we do have health centers, we try to touch everywhere we can with brick and mortar health centers. We do have our mobile unit, one of them, which is we try to get to places that need us. So we're kind of out in Washington County quite a bit, which is, they don't have a lot of options.
Yep, absolutely.
And we're really focusing, we're shifting a lot of focus in this area to, we have a lot of migrant workers in this area, which is, trying to to provide services to a diverse group of people who often do not have healthcare or health services that they can get to. And of course, we're also trying to be there for our students at SUNY Adirondack, because they don't have an actual health office or medical office on campus. But we have another 2 mobile units coming, which will be focusing on our north. So, far between, towns and little towns are very far apart and don't have either don't have health centers, or there's no transportation, or people cannot get to them. So we'll be bringing our health centers to the people, to the communities. So that's going to be rolling out, and we're going to do everything we can to meet the need that is out there. And that's our mandate. That's our mission, is to meet and provide the best quality healthcare we can to our communities. And our communities are made up of all kinds of people, and primarily a lot of rural people. So, and that's what started years and years ago. I know that someone will say, how come you don't know how many years ago? Dr. Ruggie started it decades ago with that in mind, and that's what we're still doing.
Absolutely. And, it's fantastic that you guys are doing it. You talked about, how we have a lot of J1 students and a lot of migrant workers that, come over and, help out in the workforce here. But where they're coming from there's a lot of stigma around, just not even just about HIV, but just around the conversation of sex. As you said, it's a very taboo subject. So, when you guys have these one-on-one consultations with, patients and people who may be concerned, how do you kind of go around, it's a hard conversation to have. So how do you address that conversation? How do you really start the conversation of, hey, let's talk about safe sex,
Well, so I've been doing this a long time, so I just go dive right in, that's what, at least in our team is very comfortable. It takes a little time, but it's interesting because a lot of people who come to us for testing they just start talking. Sometimes I feel like, they're like, I'm the priest and they're coming to a confession. But they talk very openly most of the time. Sometimes I'm even like, too much information, so usually it's actually a very good situation for discussion. So and it's got to be, if we model it, more people will be open to talking about it with their partners, and hopefully parents with their kids and teenagers, right? And that's what we really need to do, is have that conversation.
Absolutely. The talk is always one that, it's a hard one to bring up, whether you're the parent and whether you're the kid that has to listen to it. It's a hard conversation to kind of listen to. And so, in that kind of case with, maybe being with a new partner, how would you recommend people in these relationships and in these situations start the conversation of, hey, let's talk about it. Let's get tested, let's be safe rather than sorry, So how do you recommend somebody kind of navigate that conversation?
Well, there's a lot of ways that you can try to do that, but I always suggest humor. We always give out condoms, so that's another thing. People can always come to us for free condoms, and most of our condoms are the tried and true regular kinds of condoms, but we have some fun ones. So fun condoms are always kind of a good way to start. We have like glow in the dark condoms, so there's a good way to start the conversation.
That's
right?
A good icebreaker. Absolutely.
Good icebreaker. Sometimes just pamphlets, hey, let's look at this, let's talk about this. There's a lot of ways to try and go into those conversations, but I think humor sometimes is the best way to do it.
Absolutely. it's kind of interesting when, you know, HIV and AIDS is always like a very serious topic. But you know, obviously using that humor to kind of, you know, bring them back down, bring them to earth, knock the walls down, and realize, hey, like I am here for you. That's always a really big thing to kind of address. And it's something that isn't always taught, and it's very hard to learn sometimes. But you know, practice makes perfect. You know, making sure that you have that conversation of, you know, I want to practice safe sex, and also, you know, setting boundaries. Safe sex can mean a lot of different things for a lot of different
Exactly.
people. So, you know, having that conversation of where do you define sex as? Where do you define your abstinence as? You know, having that
Exactly.
conversation is always extremely beneficial to not only to your partner, but also to you as well. You know, now
Mhm.
you are on the same page and you're a team moving forward. So those are very big things. So, you know, as we kind of wrap up here, is there anything that you kind of really want to address about, you know, HIV and AIDS, and maybe even the Ryan White program that we didn't quite get to cover yet?
Well, I wanted to mention Ryan White himself. I think that unfortunately, a lot of people nowadays don't really know who Ryan White was.
I'm gonna be
Um,
honest, I'm that person. You know, I'm right there along with them.
yeah, so the Ryan White program is a federally funded legislative grant program. Hudson Headwaters has actually had this grant program for over 20 years, I think now, and it's been around since 1990, I believe. And so Ryan White was actually a very young person, 13 years old in the 80s, who was diagnosed with HIV, and that he was infected by a blood transfusion. He was a hemophiliac. And he wound up, you know, kind of one of the first people where we realized, oh, you can get HIV different ways. You know, you can be, you know, a young person. You're not gay. You're, you know, all these different things. And he wound up becoming kind of a face and voice for people living with HIV, an advocate.
Mhm.
And he spent his about 5 years acting as an advocate. He did pass away at 18, because we did not have anything
Mhm.
that we could really treat with. But he made an incredible impact. And the federal government did pass this CARE Act in his name. And this legislation helps people living with HIV and exists in every single state in the country.
Mhm.
So people who do have HIV can seek out Ryan White programs. There's different parts and different groups that do different types of things, but our Ryan White program does do early intervention. And we do currently have about 130 patients we work with, and some of whom I've worked with my entire 10 years. And, you know, so we are here for our patients, their families, people who are out there who just want testing or information or education. And we also do a lot of education out in the community. And so we're here for anything anyone needs. We also do hepatitis C testing while we're out there in the world, and that's a big thing, as you know, that it is often goes hand in hand with increase in drug use,
Mhm.
which is that's a whole nother thing we could talk about another day.
Absolutely. And you know, with you know, I'm sure there's, oh goodness, I forget the month, but I know there is an STD prevention month that is going to be coming up here, I believe sometime soon. I want to say February, March, right around there, but I'm not 100% on that. But you know, obviously I'm sure we'll probably have to bring you guys back on. You know, obviously with the Ryan White program, hepatitis C, STDs, STIs,
Mhm.
you know, all sorts of different things. And
Yeah.
you know, all in all, this was a very interesting podcast. You know, I can't really recall the last kind of conversation I had about, you know, safe sex and, you know, the education of it. So, you know, really appreciate you guys coming on here. Really appreciate being able to learn more about the Ryan White program, learning about all the initiatives that you guys have. So thank you so much for taking time out of your day and coming on to here.
Yeah, thank you so much, Drew. It was great.
Yeah, absolutely. So as we wrap up, I'm your host, Drew Crawford with Warren County Public Health, here with Melissa Carbone, the director of the Ryan White program at the Hudson Headwaters Health Network. And thank you so much. stay safe, stay healthy, and we'll see you all here next time.
Thanks.